Hope is really important. First of all, you have to know that God forbid you get a diagnosis of cancer, particularly breast cancer. Many, many, many breast cancers are not just treatable, but can be curable.
Can you explain to me the difference between early breast cancer, advanced breast cancer, and other types?
Early breast cancer means that the tumor is small, it hasn't spread to lymph nodes, it hasn't spread to other parts of the body. Late diagnosis of breast cancer is that the breast cancer is large, more than 5 centimeters, so more than the width of your hand, and it's spread to lymph nodes. It could spread to the chest wall, it could spread to the nipple, it could spread to the skin. Late breast cancer takes a lot more work to get rid of it.
Diagnosing breast cancer early, is that in and of itself something positive that a person should feel optimistic about?
Yes, most definitely. The key is what we call early detection. Early detection means finding a breast cancer when it's as small as possible and when it's the most treatable, which is actually the goal of screening mammograms. Because oftentimes, if we're finding it when there's some type of symptom, those cancers are larger. Mammogram allows us to see the tissue, to find those cancers when they're small and make the diagnosis then.
So for early breast cancer, what are some treatment options and how have they evolved over the course of your career?
So it used to be that mastectomy was the gold standard of breast cancer treatment. Thankfully, that's not the case anymore. There's so many options available to a patient, such as maybe no treatment, depending on how old she is. Maybe it's just a pill. Maybe it's a lumpectomy. Sometimes we add radiation to it. Sometimes we add chemotherapy. Sometimes we do very extensive surgeries. There's a lot of different types of treatments based on the type of breast cancer that a woman or a man has.
What would you tell somebody who's just received this diagnosis and they feel very alone?
First, I would say is to take things one day at a time. It can be very overwhelming. And it's okay to allow yourself to have those feelings. The second bit of advice I would give is to reach out to a support system. You don't have to be on this journey alone.
In addition to the range of treatment options available, what else is giving you hope about the future of treating early breast cancer?
I would say every 6 months, there's a major breakthrough in breast cancer. We have more and more treatments available that are changing lives, that are extending lives, that are getting rid of cancer. I love the idea that you can take a patient who's facing stage 2, 3, and even 4 breast cancer and turn around their life and maybe get them to forget about cancer. Sometimes when they come to see me afterwards, years later, and there's a small scar on their breast, and they say, well, which breast was it again? And I said, you mean that big thing that we had to deal with 5, 10 years ago? You can't remember which breast it was. I love that.